Welcome to our comprehensive series on stomach health. Over the next several segments, we will explore the most common digestive issues and how to manage them. From acid reflux and gastritis to food intolerances and IBD, our goal is to provide you with the clinical knowledge you need to thrive. We'll also cover proactive strategies like healthy dietary habits, probiotics, and the critical importance of preventative screening. Let's begin our journey toward better digestive wellness. Your path to understanding begins now. We hope this series has empowered you with valuable insights into your digestive health. Remember, knowledge is the first step toward wellness. Always consult with your healthcare provider for a plan tailored to your specific needs and medical history. Stay proactive, stay informed, and prioritize your health every day. Thank you for following this series. Thank you for watching the Stomach Health series. We wish you continued health and well-being. Hello! Today we're going to discuss the most common stomach problems and how to recognize their symptoms. Your stomach is a complex organ, and discomfort can stem from several different issues. Gastritis, or inflammation of the stomach lining, is a frequent cause of upper abdominal pain. Acid reflux occurs when stomach acid flows back into the esophagus, causing a burning sensation. Common symptoms include bloating, persistent nausea, and frequent heartburn after meals. Dietary habits, such as consuming spicy or fatty foods, often trigger these symptoms. Stress also plays a significant role in your digestive health through the brain-gut connection. It is important to see a doctor if you experience severe pain, unintended weight loss, or difficulty swallowing. Prevention focuses on smaller meals, staying hydrated, and managing stress levels effectively. Understanding your body is the first step toward better health. Thank you for watching. Today we're taking a deep dive into gastritis, a condition where the stomach lining becomes inflamed, irritated, or eroded. It can occur suddenly as an acute flare-up or develop slowly over time, leading to chronic discomfort if left untreated. A primary cause is the H. pylori bacterium, which can damage the protective mucus lining of your stomach. Regular use of certain pain relievers, excessive alcohol consumption, and chronic stress are also significant risk factors. Symptoms often include a gnawing or burning ache in your upper abdomen, nausea, or a feeling of fullness after eating. Diagnosis usually involves an endoscopy or breath and stool tests to check for infection or inflammation. Managing gastritis involves avoiding triggers and taking medications to reduce stomach acid, allowing the lining to heal. If you suspect you have gastritis, consult a healthcare professional for a tailored treatment plan. Stay healthy. Hello! Today we'll explore acid reflux, a common condition that many people experience, often known as heartburn. This occurs when your lower esophageal sphincter, a valve at the entrance to your stomach, doesn't close properly, allowing stomach acid to move up. While occasional reflux is common, if it happens more than twice a week, it may be diagnosed as gastroesophageal reflux disease, or GERD. Certain foods and drinks, like citrus, spicy foods, and coffee, are well-known triggers that can worsen symptoms. The primary symptom is heartburn, a burning pain in your chest. Others might include regurgitation, bloating, or even a chronic cough. Over time, chronic exposure to stomach acid can damage the esophagus, so it's important to manage the condition effectively. Management often involves lifestyle changes, like eating smaller meals and avoiding lying down right after eating. If lifestyle changes aren't enough, consult your doctor to discuss other treatment options. Thank you for watching. Today, we'll discuss stomach ulcers, painful sores that develop in the lining of your stomach or the upper part of your small intestine. There are two main types: gastric ulcers, which occur inside the stomach, and duodenal ulcers, located at the beginning of the small intestine. The primary causes are infection with H. pylori bacteria and the long-term use of nonsteroidal anti-inflammatory drugs, or NSAIDs. These factors weaken the stomach's protective mucus layer, allowing stomach acid to damage the sensitive lining beneath. The most common symptom is burning abdominal pain, which can be worsened or sometimes improved by eating certain foods. Diagnosis often involves an upper endoscopy, where a thin tube with a camera is used to look inside the stomach. Treatment typically focuses on eliminating bacteria, if present, and reducing acid levels to help the ulcer heal. If you have persistent abdominal pain, consult your doctor for a proper diagnosis. Thank you for watching. Today we'll discuss irritable bowel syndrome, or IBS, a common functional disorder that affects the large intestine. IBS is often related to a sensitive digestive system and how the brain and gut communicate, affecting how the bowel functions. There are three main types based on your bowel habits: IBS with constipation, IBS with diarrhea, or a mix of both. Core symptoms include abdominal cramping, bloating, and changes in the appearance or frequency of bowel movements. While the exact cause is unknown, triggers often include certain foods, hormonal changes, and high levels of stress. Since there's no single test for IBS, diagnosis involves reviewing symptoms and ruling out other conditions. Management focuses on dietary changes, such as the low FODMAP diet, alongside stress reduction and symptom-specific medications. Living with IBS takes patience, but with the right management plan, you can gain control. Thank you for watching. Today we'll explore food intolerances, a common issue where the body has difficulty digesting certain foods. Unlike a food allergy, which involves the immune system, a food intolerance is a digestive system response where you can't properly break down a food. Lactose intolerance is one of the most common types, caused by a deficiency of the enzyme lactase, needed to digest the sugar in milk. Celiac disease is a more serious autoimmune response to gluten, while others may experience non-celiac gluten sensitivity without intestinal damage. Common symptoms of intolerance include bloating, excess gas, stomach pain, and diarrhea, usually appearing a few hours after eating. Diagnosis often involves keeping a food diary, trying an elimination diet, or undergoing specific tests like a hydrogen breath test. Management focuses on identifying triggers and adjusting your diet, sometimes using enzyme supplements to aid digestion. If you suspect an intolerance, work with a healthcare professional or dietitian to ensure a balanced, trigger-free diet. Thank you for watching. Today, we're discussing inflammatory bowel disease, or IBD, a group of disorders that involve chronic inflammation of your digestive tract. The two most common types are Crohn's disease and ulcerative colitis. While Crohn's can affect any part of the digestive tract, colitis is limited to the large intestine. IBD is an autoimmune condition where the immune system mistakenly attacks healthy tissue in the gut, leading to persistent inflammation. Symptoms are often chronic and include persistent diarrhea, severe abdominal pain, fatigue, and sometimes unintended weight loss. Diagnosis typically requires a combination of blood tests, stool samples, and procedures like a colonoscopy to visualize the inflammation. IBD requires long-term management to prevent complications and achieve remission, which is a period where symptoms disappear. Treatment focuses on reducing inflammation through medications like biologics or steroids, and in some cases, surgical options. Managing IBD is a journey, and staying connected with your gastroenterologist is key. Thank you for watching. Hello, today we'll discuss how healthy dietary habits can significantly improve your digestive wellness and prevent stomach issues. Prioritize fiber from whole grains and vegetables. Fiber adds bulk to your stool and helps food move smoothly through your digestive tract. Staying hydrated is essential. Water helps dissolve fats and soluble fiber, allowing these substances to pass through more easily. Practice mindful eating by chewing your food thoroughly and opting for smaller, more frequent meals to avoid overloading your system. Incorporate probiotics found in fermented foods like yogurt or kefir. These help maintain a healthy balance of bacteria in your gut. Limit processed foods, excess sugar, and artificial sweeteners, which can disrupt your gut microbiome and lead to inflammation. Try to eat your meals and snacks on a regular schedule to help keep your digestive system in a predictable rhythm. Small changes in your daily diet can lead to big improvements in your overall health. Thank you for watching. Hello. Today we'll explore probiotics, the friendly bacteria that play a crucial role in maintaining your digestive and overall health. Your gut is home to trillions of microorganisms, known as the microbiome, which helps digest food and supports your immune system. Natural probiotics are found in fermented foods. These live cultures help replenish and balance the good bacteria in your digestive tract. It's also important to consume prebiotics, specialized fibers that act as food for these beneficial bacteria, helping them thrive. A balanced microbiome can improve digestion, reduce symptoms of IBS, and even enhance your mood through the brain-gut axis. While whole foods are best, supplements can be useful. Look for specific strains supported by clinical research for your particular needs. Supporting your gut health is a holistic process that involves a balanced diet, adequate sleep, and managing stress levels. Nurturing your microbiome is an investment in your long-term wellness. Thank you for watching. Hello. Preventative screening is one of the most effective ways to protect your digestive health by catching potential issues before symptoms even begin. Early detection through regular screening can significantly improve treatment outcomes for conditions like colon cancer or chronic inflammation. A colonoscopy is the gold standard for colon health, allowing doctors to find and remove polyps before they can become cancerous. For upper GI concerns, an endoscopy may be recommended to screen for ulcers, gastritis, or Barrett's esophagus. While general screening often begins at age 45, your family history or existing health conditions might mean starting earlier. Non-invasive options, like stool-based tests, are also available for certain screenings and can be done conveniently from home. The best screening plan is one tailored to your specific needs. Discuss your risk factors with your healthcare provider to stay proactive. Investing in preventative care today is an investment in your future. Stay healthy, and thank you for watching. Hello, today we'll discuss common diagnostic tests used to evaluate your digestive health and help provide an accurate diagnosis. An upper endoscopy allows doctors to examine the lining of your esophagus and stomach using a thin, flexible tube with a camera. Similarly, a colonoscopy examines the large intestine to screen for polyps, inflammation, or other abnormalities. Non-invasive options include breath tests for H. pylori or lactose intolerance and stool tests to check for infection or blood. Proper preparation is key. This often involves fasting or following a specific clear liquid diet before your scheduled procedure. Most procedures are quick and performed under sedation, ensuring you are comfortable throughout the process. After the test, your doctor will review the findings with you to determine the next steps in your care plan. Diagnostic tests are powerful tools for your health. Be sure to ask your doctor any questions you may have. Thank you for watching. Hello. Today, we're exploring the powerful connection between your brain and your gut, a relationship that significantly impacts your digestive health. When you're stressed, your body releases hormones like cortisol, which can slow down or disrupt your normal digestive processes. This can manifest as a knot in your stomach, increased sensitivity to pain, or changes in your bowel habits during high-pressure periods. Chronic stress may even alter the balance of your gut microbiome, potentially leading to long-term inflammation and discomfort. Managing stress is key to gut health. Techniques like deep breathing, mindfulness, and regular exercise can help calm your nervous system. Stimulating the vagus nerve through relaxation can improve the communication between your brain and gut, aiding digestion. A holistic approach, prioritizing both mental and physical well-being, is the most effective way to maintain a healthy digestive system. Listen to your body and give your mind the rest it needs. Thank you for watching.